Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to try and make a better system for all of us. Before we get started, I want to point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for today's video. It's on Substack. You can go there, subscribe for free, get it delivered to your inbox almost every day. It also contains all of the references, news articles, medical studies. All those links are there, together with a whole host of other medical resources that you might find useful. Anyway, let's get started. A friend of mine, Ronnie Schur, is a healthcare advocate in the state of Washington, and he sent me a note about an article that I wrote on the FDA's desire to withdraw approval for phenylephedra as a nasal decongestant. It turns out that phenylephedra is a good medicine, but if you ingest it orally, the stomach breaks it down before it can do any work. There are a lot of other decongestants that can work. You should talk to your pharmacist. Anyway, I have a link in the newsletter to the FDA guidance. They're also collecting comments. You can go to their website, all in the newsletter, send them your comments, and they have all kinds of resources available for you and guidance. Pseudoephedra is the thing that kind of works a little better, but you got to talk to your doctor, talk to your pharmacist. I want to now transition to another subject. Jimmy Carter passed away, President Carter passed away, and it occurred to me that it would be a good idea to compare the incoming President Trump to Carter. So we're going to do that with respect to healthcare. So President Carter was the 39th President of the United States. He recently passed away at the age of 100. When he left office, he founded the Carter Center in 1982. Now, it's not a library like other presidents do. It is a nonprofit organization that seeks to prevent and resolve conflicts, enhance freedom and democracy, and improve health. The Carter Center is focused on improving the world. Now, if you happen to speak Hebrew, that's called Tikkun Olam, heal the world. Anyway, guinea worm eradicated. That's one of their big successes. Among the organization's many efforts, the Carter Center helped spearhead a successful international campaign with the goal of eradicating I'm going to get this wrong, dracunculiasis. I hope I said it right. It's also called guinea worm disease. It is a parasitic infection caused by consuming contaminated drinking water. Water from ponds or other stagnant bodies of water can contain tiny crustaceans commonly known as water fleas, which in turn can be infected with the guinea worm larva. Now, this is according to the CDC. About 1 year after being infected in a human, the guinea worm creates a blister on the skin and emerges from it, which can cause burning, pain, fever, and swelling. This also according to the CDC and the World Health Organization. Nobody else wanted to take it on, Jimmy Carter told ABC News' George Stephanopoulos during a 2015 interview on Good Morning America. So I decided to take it on. In 1986, guinea worm disease afflicted 3.5 million people every year in 21 African and Asian countries. Disease incidence has been reduced by 99.99%, get this, 14 provisional cases only worldwide in 2023. That's according to the Carter Center. Let's talk about snail fever and elephantiasis. The Carter Center also works to fight other preventable diseases, including the parasitic infections, schistostomaniasis, I'm going to get that wrong, and lymphatic filariasis, more commonly called snail fever and elephantiasis, respectively, as well as trachoma, which is one of the world's leading causes of preventable blindness. It's also working with the governments of Haiti and the Dominican Republic to eliminate lymphatic filariasis and malaria from the island of Hispaniola, which both countries share, and which is the last reservoir in the Caribbean to both diseases, according to the Carter Center. Now, Carter and his organization played a part in organizing a major drug donation program to help eliminate onchocerciasis, also called river blindness, which is transmitted to humans through repeated bites of infected black flies, according to the CDC. Now, he got drug manufacturers to help. The pharmaceutical company Merck had been implementing field studies in Africa which showed that the drug ivermectin was effective at treating river blindness in humans because it's really good at attacking parasites. The Carter Center partnered with Merck to mass distribute ivermectin as much as needed for as long as needed. Get that, in Africa and Latin America. To date, the Carter Center has assisted in distributing more than 500 million treatments of ivermectin, according to Merck. They arranged for a ceasefire to enable life-saving vaccines. In 1995, Carter negotiated a 2-month ceasefire in Sudan to allow healthcare workers there to more safely help eradicate guinea worm disease and prevent river blindness and to vaccinate children against polio. All of this according to ABC News. Let's look at Trump. He sought to cancel the Affordable Care Act. Trump continually demanded a repeal and replace of the Affordable Care Act from the start of his last presidential term. He took aim at the ACA consistently with his campaign pledge leading up to the 2016 election to repeal and replace. He supported many efforts in Congress to repeal the law and replace it with an alternative that would have weakened protections for people with pre-existing conditions, eliminated Medicaid expansion, and reduced premium assistance for people seeking marketplace coverage. This is all according to the Journal of the American Medical Association. Millions lost health care coverage under Trump even before COVID. Meanwhile, 2 million people and more, including children, lost their health insurance before COVID. There's a link to the Center for American Progress website that details that analysis. He needlessly increased U.S. COVID deaths. The UK medical journal, The Lancet, established a commission to determine how many deaths from COVID the U.S. could have avoided if they would have behaved like the rest of the industrialized world. The commission weighted the average death rate in the other G7 countries, Canada, France, Germany, Italy, Japan, and the UK, and compared it with the U.S. death rate. All of them have universal health care. In another comparison, the commission found if U.S. life expectancy was equivalent to the average in the other G7 countries, about 461,000 fewer Americans would have died in 2018. The Lancet Commission on Public Policy and Health in the Trump era, launched in 2017 to catalog Trump health policies, examines the driving force of his 2016 election and offers policy recommendations. The 33 commissioners were from the US, the UK, and Canada. They all work in public health and in law schools, medicine, in unions, and indigenous communities and other groups. You can find a link to their report. Medicare and Medicaid reductions. The Trump administration proposed spending reductions in both Medicaid and Medicare, along with proposals that would promote flexibility for states, but limit eligibility for coverage under Medicaid, that is, work requirements. Now, we saw a few weeks ago what a failure those work requirements were. You can go to the Healthcare Advocacy newsletter, search on Medicaid. You can read about that disaster in a link I have in the newsletter in the YouTube description box. I'll give you a quick example off the cuff. Georgia implemented the work requirements. They had about 250,000 people who were not in Medicaid due to income requirements, and they offered a work requirement. They actually make too much money. So if they would have expanded Medicaid, they would have picked up 250,000 people or so. Instead, they put in the work requirements, and in a year, there's about 5,000 people extra they put on the work on Medicaid. Compare that, 250,000, 5,000. And they spent tens of millions of dollars to do it, and had they just expanded Medicaid, it wouldn't have cost them any more because of the way the Medicaid expansion is structured. It's just cruel. Anyway, prescription price failures. Trump claimed in his first administration prescription drug prices were a top health priority, and he issued several executive orders to lower drug prices. Most of these were never implemented. The only exception to lower the cost of insulin for some Medicare beneficiaries with diabetes, and another allowed pharmacists, get this, to tell consumers they could save money on their prescriptions by using coupons like GoodRx. Just shoot me. Anyway, they always do that anyway if you ask them. Okay. In the future, Trump has proposed RFK Jr., a conspiracy theorist, a supporter of an anti-vax group that has actually sued the FDA to remove authorization for polio vaccine. It was actually his personal attorney that filed the protest to the FDA in 2022 to get the polio vaccine rescinded. RFK Jr. does not want to support public health by encouraging childhood vaccinations for things like measles, mumps, and rubella. He supports and promotes anti-science, anti-government conspiracy theories, and he recommends allowing people to opt out of childhood vaccinations. This will put children in mortal danger and endanger the health of our communities needlessly for political power. I have no words to describe how hateful this is. Okay, let's summarize it. It's clear. President Carter was someone who cared about people and tried to make lives better for people he would never meet. He made sure to eradicate diseases that caused untold human suffering. President Trump seeks to make more money for big business with fake crisis health insurance plans. He lied to America. He actually allowed people to use those fake crisis health insurance plans for 3 year at a time period instead of the original 3 months that they were supposed to be used for. He lied to the Americans and caused more than 400,000 people to die needlessly. That's about COVID. Remember, inject yourself with bleach. Trump proposed that the Department of Health and Human Services be headed by someone who is anti-public health. This is like Alice in the Looking Glass. All I can think of is everything is backwards with that guy, and we will all suffer. There is no comparison. Carter loved people, Trump loves money and power. I'll pick someone who loves people any day. Look, I didn't put an action in today's newsletter, but in the YouTube description box, you can find a link that'll get you in touch with your senators. Call your senators, email them, tell them RFK Jr., no way. That's what I've got for you today. Down below, you can like, share, subscribe. You can go to the Healthcare Advocacy newsletter and subscribe. You can send me email here or at healthcareadvocacy1@gmail.com. Have a good day.